Hello everyone, welcome to my YouTube channel Health Matters. Today I want to talk about diabetes. Diabetes is a condition that happens when your blood sugar, glucose, is too high. It develops when your pancreas doesn't make enough insulin or any at all. Most forms of diabetes are chronic, lifelong, and all forms are manageable with medication and lifestyle changes. But before we continue this video, I would like to tell you the meaning of insulin. Insulin is a hormone produced in the pancreas which regulates the amount of glucose in the blood. Lack of insulin causes a form of diabetes. Now I'm going to tell you the meaning of pancreas. Pancreas is a large gland behind the stomach which secretes digestive enzymes. It makes pancreatic juices which contains enzymes that aid in the digestion, and it produces several hormones. Okay, now we are going to be looking through the types of diabetes. We have type 1 diabetes, we have type 2 diabetes, we have gestational diabetes, we have maturity onset diabetes of the young. We also have the neonatal diabetes, we have the Wolfram, we have the latent autoimmune diabetes, we have type 3C diabetes, steroid-induced diabetes. Now we are going to be talking about the first type of diabetes, which is type 1 diabetes. This is where your blood glucose, which means sugar, level is too high because your body can't make a hormone called insulin. This happens because your body attacks the cells in your pancreas that makes the insulin, meaning you can't produce any at all. We all need insulin to survive. It does an essential job. It allows the glucose in our blood to enter our cells and fuel our body. Now, type 2 diabetes. With type 2 diabetes, the insulin your pancreas makes can't work properly, or your pancreas can't make enough insulin. This means your blood glucose, sugar, keep rising. Around 90% of people with diabetes in the UK have type 2 diabetes. It is a serious condition and it can't be lifetime. Now, having type 2 diabetes without treatment means that high sugar level in your blood can seriously damage your eye, your heart, and your feet. These are called the complications of diabetes. But with the right medication and treatment, you can live well with type 2 diabetes and reduce your risk of developing them.
Okay, this is a diagram demonstrating the complications of diabetes mellitus. Now we have the complications include the cerebrovascular disease, the permanent kidney damage, diabetic foot infections, retinopathy and blindness, the heart attack and peripheral and neuropathy.
Now, the third one we have is gestational diabetes. This diabetes can be developed during pregnancy. It affects women who haven't been affected by diabetes before. It means you have high blood sugar and need to take extra care of yourself and your pump. This will include eating well and keeping active. It usually goes away again after giving birth. It is usually diagnosed from a blood test 24 to 28 weeks into pregnancy. Now we have neonatal diabetes. This form of diabetes that is diagnosed under the age of 6 months is a different type of diabetes than the more common in one diabetes. Now, I'm going to be telling you the causes of diabetes. Too much glucose, which is sugar, circulating in your bloodstream cause diabetes, regardless of the type. Now, we have one, insulin resistance. Type 2 diabetes mainly results from insulin resistance. Insulin resistance happens when cells in your muscles, your fat, and liver don't respond as they should to insulin. Several factors and conditions contribute to varying degrees of insulin resistance, including obesity, lack of physical activities, diet, hormonal imbalance, genetic and certain medication. Now we have two. autoimmune disease. Type 1 diabetes happens when your immune system attacks the insulin producing cells in your pancreas. Before I continue this video, I would like to tell my viewers, my subscribers, and my followers to like, comment, and subscribe to my YouTube channel so they can get notified anytime I post a new video. And if there is something you would like me to talk about in my next video, please list it down in the comment section. I will read it and make a video about it. Now, the third causes of diabetes is hormonal imbalance. During pregnancy, the placenta releases hormones that cause insulin resistance. You may develop gestational diabetes if your pancreas can't produce enough insulin to overcome the insulin resistance. Now we have pancreatic damage. Physical damage to your pancreas, like from a condition. Two, surgery or injury can impact its ability to make insulin, resulting in type 3 diabetes. Now we have genetic mutations. Certain genetic mutation can cause diabetes. Now, note that long-term use of certain medication can also lead to type 2 diabetes, including HIV medication. Now, I'm going to be telling you the signs and symptoms of diabetes. Increased thirst and dry mouth is a symptom of diabetes. Two, frequent urination. Three, fatigue. Four, blurred vision. Five, unexplained weight loss. Six, numbness or tingling in your hands or feet. Seven, we have slow healing sores, wound or cuts. Eight, we have frequent skin infection or vaginal yeast. It's important to talk to your doctor, healthcare provider, if you notice any of these signs and symptoms in you or in your child. Let's talk about how you can manage diabetes. Now, you have to be monitoring your blood sugar. Two, you have to be using oral diabetes medication. Three, you have to be injecting synthetic insulin to live and manage diabetes. Four, diet. You have to be planning your meal. Choosing a healthy diet for you is a key aspect of managing diabetes, as food greatly impacts blood sugar. Now you have to be exercising more often and having physical activities daily. And we also have six, which is due to the increased risk of heart disease. It's also important to maintain a healthy weight. Yes, you have to maintain a healthy weight. You have to control your blood pressure and maintain a healthy cholesterol. And I'm going to be telling you the prevention of diabetes, which is eat a healthy diet and get physically active every day and manage your stress, get adequate sleep, and quit smoking and drinking. Okay, thank you very much for watching my video. I hope you have subscribed, like, and comment about this video. Okay, see you in the next class. Bye bye.